Clear how this would work? I mean, I know obviously.
안녕하세요. 매일매일 운동하기를 실천하고 있는 동타왕군입니다. 졸려. 오늘은 영어학원 가는 날입니다. 1시간 일찍 일어났어요. 일단 운동 걸어 하겠습니다. 오늘도 비가 오네요. 어저께 내 우산 누가 가져갔어요, 회사에서. 진짜 이런 장마철에 우산을 훔쳐가면, 야이 도둑놈아, 내 우산. 오늘 출근했을 때 회사에 제 우산이 그대로 꽂혀있기를 희망이 옵니다. 일단 운동할게요. 스트레칭 먼저 하고.
After Ben Sass, who is a Republican from Nebraska, Sass put out a very lengthy tweet, and I'll just read you part of the tweet that he said in his retort. He said, "No president, whether named Obama or Trump or Biden or AOC, has unilateral power to rewrite immigration law or to cut taxes or to raise taxes. This is because America doesn't have kings." This is probably the most consistent message that we've heard from any Republican since they were saying the same thing about President Obama. But so far, Ben Sass is the only one to speak out as clearly and as forcefully to be that consistent on the Republican side.
Sanjay, the president continues to, talk about children and this virus. Now, nearly 180,000 kids have tested positive for COVID in the last 4 weeks. The president, just to be clear, he's now saying that kids don't transmit the virus like everybody else. They don't transmit the virus easily to adults or to their grandparents or to their loved ones, and they don't even get the virus in a way that like other people do, let alone, obviously we know that in general, the way their bodies handle the virus is different.
Right. I mean, the one thing we can say is children do seem to get less likely to be sick from this virus, and that is data that we originally saw coming out of Wuhan, and it is held up, for the last 6-7 months now. But the other 2 points, they certainly can become infected and do become infected. You're infected if you're carrying the virus. And they certainly can transmit the virus, and they do transmit the virus. We know, there's been a couple of studies, the people have been talking about these studies a lot lately, but the South Korea contact tracing study, they traced contacts of over 50,000 people. And they basically trying to figure out how likely are different age groups to spread the virus. And what they said, that starting at age 10, basically, you're starting to spread the virus like an adult. When I looked at this data closely, and I talked to some sources in Korea, you should also note that children under the age of 10 largely didn't have many contacts. So out of 50,000 contacts, for example, in that study, only 57 contacts were in children ages 0 to 9. So I bring that up to say, I think the jury is still out on younger kids. We know that they can carry a lot of virus in their nose and their mouths. I think, Anderson, I think they've just largely been at home, these younger kids, since middle of March. They're starting to be out and about more and more now the last couple of months of school, starting in some places and things like that. But I think, kids can get infected and they can spread the virus, which is a concern.
Well, to that point, the World Health Organization recently said that the virus, that the pandemic started to move into the younger population globally. Do we know what that's attributed to? I mean, I guess just logically, what you just said makes sense, which is as kids are going to, are no longer as isolated, they're going out there, they're more likely to, spread and or get the virus. And I guess testing is, if it's more widespread, then more kids are going to get tested.
Yeah, and to be clear on this, because this always gets confused for whatever reason, the virus is out there, people are infected, testing is simply picking that up. Testing doesn't cause people to become infected. I think most people understand that. But I think you're absolutely right. I mean, I could tell you just from my own personal experience and then talking to members from the American Pediatrics Association, it's been hard for kids to get tests. Mostly tests have been reserved for people who have some sort of symptoms. And again, kids are less likely to get symptomatic. That part is true. But now I think in part because they're thinking about going to school or going to sports, things like that, they're trying to get more tests. That could be contributing to this increase. But also, I do think it's just there's increased mobility among even younger kids now, and that's really, I think, contributing to this. If you look at the numbers in the United States, you've had, as you mentioned, close to almost doubling of the number of children now confirmed to be infected over the last month. Just over the last month. So that also tells you something. Again, they were largely at home for a period of time and now out and about.
Yeah. Sanjay, thanks so much. Dana Bash as well. Still to come tonight, will there be college football season? New reports suggest there may not be for the big teams. Ramifications, though, no matter what decision schools make. Legendary announcer Bob Costas will be here to break it all down for us. And later, inside Joe Biden's vice presidential search, the top picks and when the big announcement may come. More on that when we continue.
Challenge out ahead of us in terms of figuring out how to return safely from COVID. We've done a massive amount of work and are advising our clients on this. I do think companies are coalescing around some standard ways to get it done, and I believe that once we get on the other side of COVID-19, things will settle out and people will be able to go back to the office in a healthy way. What our clients have told us in the research we've done is that on a go-forward basis, they plan to provide flexibility to their employees. Some opportunity to work from home, some opportunity to work from the traditional office. They think both are very important. Working from home allows people to be attentive to certain things related to their health. Working from office promotes collaboration, building culture, etc. So we should expect to see both in the future.
Please wear a mask.
Social distancing is absolutely critical.
Continue to practice good hygiene, wash your hands.
You've heard these things over and over, and according to a new study, these steps won't just help coronavirus from spreading, but could pretty much prevent any future outbreaks. The study published in the journal PLOS Medicine says that in order for that to happen, 90% of a population has to adopt these behaviors. The research is based on the interaction of people in the Netherlands, but those behind the study say it can be applied to other countries. Researchers say governments need to continue to drive home how easily coronavirus spreads.
These are our instruments of freedom because they will give us the freedom to open and to stay open and to be able to protect those who we love.
The 2020 elections are coming. The Democrats, the Republicans. Special live coverage starts August 18th, only on CNN.
A mask can say a lot about the person who wears it. But even more about the person who doesn't.
Coronavirus is affecting an entire country, the world. Are we ready? In the beginning,
배고파.
nobody knows what's happening. We're determined to keep reporting the story. Because that seems to be what worries the American. Because we're ready for it.
배고파.
These are the
저
moments
얼마나
where our
있지?
humanity
시간이 안 보여.
really does shine through. That's the hardest part.
It's heart-wrenching.
알고
Dr.
싶어.
Sanjay Gupta, CNN.
At the top of the program, we mentioned a startling new report from the American Academy of Pediatrics and the Children's Hospital Association about the sharp recent rise in coronavirus cases among children. President Trump was asked about the report during his briefing. Here's what he said.
Does that give you any pause about schools reopening for in-person learning?
Because they may have, as you would call it, a case. It may be a case, but it's also a case where there's a tiny fraction of death, tiny fraction, and they get better very quickly.
So you believe that children are essentially immune?
Yeah, I think that for the most part they do very well. I mean, they don't get very sick. They don't catch it easily. They don't get very sick. And according to the people that I've spoken to, they don't transport it or transfer it to other people, or certainly not very easily.
Dr. Sean O'Leary is vice chair of the American Academy of Pediatrics Committee on Infectious Diseases. It was his organization that helped produce that report. Also with us is Dr. Peter Hotez, Dean of the National School of Tropical Medicine at Baylor College of Medicine. He's also working on a potential COVID-19 vaccine. Dr. O'Leary, thanks for being with us. Do we know why there has been this 90% increase in the number of COVID cases among kids in the U.S. over the last 4 weeks?
Yeah, good question. I think it's probably a combination of factors. You know, one, remember early in the pandemic, we were really only testing people that had severe illness or were being hospitalized, people in long-term care facilities. So now, as testing capacity has increased somewhat, of course it varies by region, more children are able to get tested. So I think that's one thing. I also think there probably is some element of more children are actually getting infected than they were before, with increased activity, et cetera, getting out and about more often. And the other thing I would point out is that what we're seeing in children is really it just reflects what we're seeing in the rest of the country. When you see a lot more infections in the general population, you're going to see a lot more infections in children, and that's what we're seeing.
And Dr. Hotez, the president said today that kids don't get very sick. He's repeatedly said that kids are virtually immune, and he's now saying that they're not transmitting it. They don't really have a hard time transmitting it to adults. How concerning we talked about this with Sanjay, but just factually, that's just not the case.
Yeah, thanks.
Oh, sorry, that was for Dr. Hotez.
Oh, sorry.
Sorry.
Well, what I'll just say is, first of all, congratulate Dr. O'Leary for putting out, the American Academy of Pediatrics putting out some very important documents now about COVID-19 in children, and they're really important. I'd like to just congratulate Dr. O'Leary and his team on getting this out. Yeah, I think they're responsible for quite a bit of transmission in the community. We know this. We heard it from Sanjay, the South Korea study, kids over the age of 10, but now we know even the little kids from a paper in JAMA Pediatrics, they have lots of virus in their upper airway and their mouth and their nose, and even if they're not releasing as much virus particles, they're still accounting for some transmission. And the point is, and we know what happens when we open up schools in communities where the virus is either accelerating or even if it's at a plateau, but at a very high level. This is true across the South now. We have seen what happens in Georgia when we open up schools. There's lots of new cases, and then the risk, of course, is to the older teachers, those with underlying conditions, hospital staff, bus drivers, and teachers will get sick, and this has happened in Georgia now. It will happen in Florida when Florida schools open. It will happen in Texas and other states where you have a lot of transmission, and it will fail. It'll fail catastrophically, and so we still have come back to this problem over and over again, where the White House will not lead a containment strategy, especially for the states where there's lots of transmission. And what they simply won't happen. We cannot open schools safely and keep teachers safe.
Dr. O'Leary, the president is also saying that kids don't get the virus as easily as the rest of us. I understand that kids, what we do know, and Sanjay reiterated this earlier, is that kids may have it and be asymptomatic, or more likely to be asymptomatic. That's known. They respond differently to the virus. But the idea that do kids get it? Can one say that it's harder for kids to become infected in the first place?
Yeah, I think that science is still being worked out, to be honest. It appears perhaps from some studies that younger kids may be less likely. He mentioned the South Korea study, and if you look at it, the number of children in that study that were infected was relatively small, right? So I think the science is still being worked out. The one thing I do want to point out, though, is that it's not fair to say that this virus is completely benign in children. We've had 90 deaths in children in the U.S. already in just a few months, right? Every year we worry about influenza in children, and there are roughly around 100 deaths in children from influenza every year. But when we look at, just this short segment, the small percentage overall of children that have been infected across the U.S., this is not, we can't say that it's completely benign in children. Yes, it's much less severe than it is in adults, particularly older adults, but we all have to take this virus seriously, including taking care of our children.
And to that point, does it, do we know that kids, I mean, is it fully known sort of any potential long-term effects that kids may have? I mean, we're obviously all learning about this virus as we go. And kids haven't had it as long as, it's only been around for 6 months. So is it safe to say that if they get it, there's not going to be some follow-on effect down the road that we don't know about?
Well, I think, as you pointed out, we're all learning about this virus every day, and we were already surprised by this multi-inflammatory syndrome in children, where kids get very, very sick. And that seems to happen 2 to 4 weeks after a COVID infection. I think you've probably heard about the COVID long haulers, the adults that have long-term symptoms. We don't really know if that's the case for children. There have been some anecdotal reports of children that have lingering symptoms, but I think there's still a lot to work out in that arena.
Dr. Sean O'Leary and Peter Hotez, thank you so much. Appreciate it. Sobering milestone was just reached. The global case of coronavirus has now reached 20 million globally, according to Johns Hopkins University, 20 million cases worldwide. With that as a backdrop, President Trump also weighing in on reports that the college football season could be canceled. He said on Twitter colleges should play, even as news outlets, including ESPN and Sports Illustrated, report that the top 5 conferences, known as the Power 5, are discussing postponing the season. No decision has been reached. Pressure against canceling the season is coming not only from the president and members of Congress, but some players as well. Joining us now, Hall of Fame broadcaster and senior contributor Bob Costas. Bob, how big a deal would it be if college football gets canceled altogether?
Well, as we've mentioned before, it isn't just the interest in college football and the revenue that it brings to support what are often gargantuan, almost grotesquely overblown football programs with the salaries of staff and the facilities and all the rest. It seems to have departed from a real student-athlete model in too many cases. But what can be said for college football and basketball is that they support the lesser, I don't mean lesser in importance, but lesser in terms of revenue and general interest. They support tennis and soccer and lacrosse and swimming and crew and whatever else. So when that revenue goes, and we're talking nationwide about billions and billions, when that revenue goes, there will be a ripple effect on the other programs within these universities. I know that, as you mentioned, a number of players want to play, and some 1,000 or more around the country put out some sort of list of demands without which they would not return to play, which included a 50-50 split of the revenue. That's just not going to happen. I know that there are many people who have said for years, hey, these athletes aren't compensated. But in a true student-athlete model, if sanity prevailed, the scholarship could be worth well more than $500,000 over the course of 4 years or more in some situations. So if these are truly student athletes, and if the programs don't put such demands on them that they're constantly practicing, constantly traveling, there to practice before classes are even in session, in the case of football in August, if you got back to something that was more proportionate, then the scholarship would have more meaning. But meanwhile, these players did say, we want to play, including Trevor Lawrence, the great quarterback for Clemson. But the bottom line is that these conferences have now decided, the Power 5 expected in the next few days to join the Ivy League and the Mid-American Conference and the Mountain West. They've decided that it just is not practical. You just can't do it. There's too many needles to thread. The size of the rosters is too large. If they're going to interact with other students on campus, there's bound to be infection spreading back and forth. And if you're going to isolate them the way pro athletes can be isolated in a bubble, like the NBA and the NHL, then aren't you just declaring this has nothing to do with education, has nothing to do with these kids being on campus? They're here to generate revenues. Yeah. Isn't that basically what you're saying if you isolate them?
You know, essentially, you were hearing from Senators Ben Sasse, Marco Rubio, Jim Jordan. Someone spoke about a need for football. Obviously, for people who love football, it's incredibly important. To many in America, it's an incredibly important thing. I guess the question is, how does the need measure up to a global pandemic?
And especially if you're talking about football, or for that matter, basketball outside a bubble. The NBA appears to be successful because they're in a bubble. But playing basketball, you're breathing on each other, you're in close quarters, you're sweating on each other. But for the moment, that's not the issue. Football is the issue. Try to think of an activity that would be less conducive to containing a pandemic than playing football. The size of the rosters, constant close contact on every play, and a huddle between every play on both sides of the ball. 22 players at a time, offense and defense. Let's get in a huddle and talk to each other in a huddle.
Also,
It's
travel.
ridiculous.
I mean, traveling teams is a huge task.
Yeah, now most of the conferences, when they intended to play and they put out somewhat condensed schedules, they wanted to play only within their conferences. So they cut down on out-of-conference games, and that's more far-flung travel, but still you have to travel. Even within conferences, there's airplane travel involved in some cases. It's just impossible to manage. We've seen that even in baseball, where the players are tested regularly, where they have all kinds of protocols, where you're talking about a smaller number of players in total, and yet there have been outbreaks on the Miami Marlins and on the St. Louis Cardinals that has disrupted the season. College football is far more far-flung and would be much more difficult to control.
Bob Costas, great to have you as always. Thanks, Bob.
Thanks, Anderson.
Up next, I'll talk with the aunt of two high school students who tested positive for coronavirus. They attend that Georgia school, seen in this now infamous crowded hallway photo. Be right back.
How important is 1 year in a startup? It's everything.
It's kind of life or death for us.
1 year is a century in the life of a startup.
Year one is absolutely crucial.
It's good to meet you.
This month, catch up with the startup scene in Dubai. A year after these young, ambitious entrepreneurs launched their dream to make it big.
You like that one?
How do they face their biggest challenge yet?
I don't think anyone was prepared. No company was prepared for a pandemic.
Follow that startup Saturday on CNN.
Whoa, whoa, whoa. We need to be 6 feet apart when we argue.
This is the closest we've been in years.
하고 별표기 10개만 하고 끝내겠습니다.
I'm Will Ripley in Tokyo, Japan, and this is CNN.